Assalamu alaikum and welcome back to another episode of What's Up Doc. I'm your host, Dr. Aalia Al-Barwani, and I'm a board-certified physician. My show, What's Up Doc, is a production of Muslim Network TV, the only Muslim-focused network broadcasting in North America. You can find our shows on our website at muslimnetwork.tv or on our YouTube page at youtube.com/Muslim Network TV. Our shows are also streaming almost daily on Roku TV, Apple TV, Fire TV, and Galaxy 19. Heart disease remains one of the top causes of death globally. In the United States, someone has a heart attack every 40 seconds. A heart attack, also known as a myocardial infarction in the medical community, is the topic of our show today. And joining us in that discussion is Dr. Usman Khan, a physician, board-certified in interventional cardiology, cardiovascular diseases, internal medicine, nuclear cardiology, and echocardiography. He's the owner and founder of Epic Heart and Vascular Center here in Houston, and he has many regional and national publications and awards. And we're very lucky to have him join us today. Welcome, Dr. Khan.
Thank you very much, Aalia. I appreciate you giving me time.
We appreciate your time so much. Mashallah, you have a lot of amazing accreditations and awards. As I mentioned before we started this show, there were way too many for me to list, but we'll definitely flash your information here on the screen. That way, if anyone would like to reach out to you or has any questions or wants to be a patient of yours, then they have that access to you. So today, the topic, as I mentioned, is heart attacks or myocardial infarctions. And I found this amazing statistic that someone has a heart attack every 40 seconds. That's very disturbingly high number. And I'm sure you see, of course, the brunt of these patients who suffer from heart attacks. So let's start at the beginning with defining, for those who may be lucky enough not to have experienced or know or have any familiarity with heart attacks, what happens during a heart attack, and what are we referring to when we use that term?
Absolutely. I think this is very important for all of the people to know in general, and also not only just the people who deal with the medical issues, but also any common man, because this is a life-threatening situation. And also, as you rightly pointed out, it's a very common entity. It's a big public health hazard. So basically, the heart attack is a general term we use where the people have an acute heart emergency. Mostly, it is highlighted by the chest pain, and the mechanism involves the sudden blockade of the vessel of a heart that supplies the heart muscle. So therefore, there is a reduction in the blood flow in the heart muscle. And as a result, the people experience a certain onset of chest pain. Sometimes the symptoms can be a little atypical or missing, and still people can have the acute heart attack. So this is, in brief, what a typical heart attack is. There's a sudden, abrupt occlusion and obstruction in the blood flow of the vessel, and that jeopardizes the blood flow in the heart muscle. Having said that, there are different other mimics of this entity where people can have chest pain, although they don't have typical heart attack, or similarly, they can have heart damage because of certain other reasons, but they don't have the obstruction in the blood flow of the heart.
Excellent, thank you. So I like to describe to my patients a hose as if you were watering a garden, and if you get a kink or if you have dirt accumulation in the hose causing blockage, such as plaques that we'll probably get to later, or if you have anything externally causing problems with flow, then that can cause no water to end up on the other side. And sometimes breaking it down even further for my patients, because of course in primary care they're usually not as familiar if they're coming to you. I think there's some kind of familiarity there. So blood flow problem to the heart itself. Now, what puts somebody at risk for a heart attack? Let's talk about that, because I think that'll shed a little bit of light into the things that you were talking about a minute ago.
Absolutely. We need to understand that the heart disease of that nature is basically a gradual process that starts actually in the childhood, and it silently grows up to the extent where it can cause symptoms or it can cause an acute heart attack, as we are talking about. So the disease process itself typically is labeled as the term atherosclerosis, which is basically the deposition of the cholesterol in the vessel wall that makes it damaged, diseased, and later on, this pile of the cholesterol can get worsened and get narrow down the blood flow in the blood vessel. At the same time, sometimes the changes can happen to the blood vessel acutely, where the plaque vessel can suddenly become obstructed because of the clot formation or fissuring or the damages in the plaque itself, where it actually presents as an acute heart attack. So it's basically a continuation of the same disease process that started early in the childhood. Now, answering your question, what makes this all happen? In a nutshell, if I say there are two kind of main risk factors, one of them are modifiable, and the other ones we clinically call non-modifiable. For example, some of the non-modifiable risk factors that contribute to this entity include the age. So as we grow older, there's a more risk of developing atherosclerosis, plaquing in the vessels, narrowing, and heart attack. Similarly, the male gender is more vulnerable, is more prone to this entity compared to the females of the same age group. The genetics play a big role too. So, a familial predisposition is an important risk factor. Now, coming on to the modifiable risk factors, we have some very important ones. And while I'm highlighting some of those, please remember that 80% of the disease is said to be modifiable. So if there is a good control on the risk factors, there's a fair chance that despite having some of the non-modifiable risk factors in the background, we still are capable of modifying and minimizing the progression of the disease and the heart attacks. So the modifiable risk factors include high blood pressure, high cholesterol, diabetes, also the lack of exercise, type A personality, and smoking in particular is a very important modifiable risk factors. So this is the combination outcome by both the modifiable as well as the non-modifiable risk factors that lead to this critical life-threatening emergency of a heart attack or a heart disease. And therefore, while we are trying to look into the ways to minimize or prevent such an entity, we need to focus our attention onto those modifiable risk factors to prevent that from happening. And even in the people who have heart attack, these risk factors are extremely important to be modified and mitigated so as to prevent any future complications or progression of the disease.
Amazing. Thank you for sharing that. I love how you broke that down for us into two different boxes of modifiable and non-modifiable. As you said, non-modifiable, unfortunately, there are things that we have little to no control over. But here that up to 80%, there's up to 80% of impact by modifying the modifiable factors. That's really impressive. That's really high number. I would not have thought that. And that gives hope for a lot of patients who tell me, well, my dad had a heart attack and this other person in my family did. And so sometimes I hear patients feel hopeless that it is in their future to have a heart attack. And so they're going to keep smoking or keep doing whatever it is that is actually a modifiable factor. So it's really good to be able to encourage them by sharing this information with them that actually you have up to an 80% chance of impacting your road towards heart disease. So thank you for saying that. Outside of the modifiable factors that you just mentioned, are there specific things that one who maybe, if they are at high risk or even someone at moderate risk, something that they can do to lower their risk even further? And so when I asked that question, I know you mentioned exercise. Is there a certain amount of exercise that's encouraged? Are there specific supplements or other things that in a lifestyle that might help someone to lower their risk even further?
Absolutely. I think excellent question, because if we have to think about preventing the disease or the retarding the progression of the disease, these modifiable risk factors, as I said, they play a vital role. Not only just to say that, yes, they play maybe more than 80% of the role. Importantly, if we look around and if we gather the data tells us that actually only 1 to 2% of the population in general is actually practicing those modifications in their lifestyle. So therefore, there's a lot of room and there's a lot of things that can be done and should be done. And as professionals, we have a lot of room to educate the community, and the community has to take action as well in terms of not only educating themselves, but bringing those measures into practice. So what are the things, as you asked me about? So starting from the general lifestyle modifications, first and foremost, looking up to your diet. So they say we are what we eat, and that's very true. The dietary, uh, you know, um discipline is extremely important, not only just for the heart disease, heart attack in particular, for the high blood pressure, for diabetes, for high cholesterol, for your weight control, for your health overall. And I mean, I don't want to go into the extent of all the other health benefits, but focusing again on this particular entity of the heart problems, the balanced diet, where it should be a combination of fruits, vegetables, dairy products, grains, not just too exclusive and too much oily, cheesy, greasy things, not too much salt in the diet. These are extremely vital. Similarly, in terms of the exercise, as you rightly pointed out, the maximum benefit a person gets from the exercise is when from their sedentary or their non-exercising sort of situation, they start taking the lead into the exercise. So let's say even somebody is just sitting on the office chair most of the time, they are just moving around without any exercise. Once they go on the treadmill or they start running or jogging or brisk walk, even if they do it 5-10 minutes a day, that is the greatest benefit that goes to their health immediately. Yes, there's more benefit as they excel a little more, put a little more effort, put a little more time into more exercise. And the recommended amount of exercise, if you would say, by the American College of Cardiology, American Heart Association, it's 30 to 40 minutes of a moderate activity 4 times a week. That is kind of the goal we typically tell most of our patients in order to get to their goal. But as I said, if let's say a person is obese and they're not doing exercise, now coming on to and start doing exercise is going to give them a lot of benefit, even if it's not up to the optimum level. So one should not be discouraged if they're not able to get the goal immediately. Secondly, apart from that, we mentioned about the smoking, which is extremely important, not only just for the heart attack. As we know, there are multiple health hazards associated with the smoking. And the other things, as you mentioned about the high blood pressure control, so the diet has an important role, the low salt diet, exercise, and the health hygiene, the sleep habits, all those things, and also reducing the stress. That also has a critical role, not only controlling the blood pressure, also preventing the heart disease. Similarly, if somebody has hypertension, high blood pressure issue, taking their medications and controlling it in within strict limits, because the studies have clearly shown that it's not the number of drugs, but more so it is the numbers on the blood pressure control that affect the most. So I see some of the patients who get a little frustrated if you try to push for a couple of medication opposed to a single medication for the blood pressure control, since they have maximized on the dose, and they would think, oh, probably they would just not take it, but actually they pay a higher price by not taking and keeping their blood pressure high as compared to if they were taking 2 or 3 medications even. So blood pressure control and being honest with yourselves, checking it regularly, reporting to your physician, taking your medications, and whenever it's needed to modify and accelerate the medication, we have to. And this is right in the benefit and going to be the right strategy to prevent the long-term problems without not only just the heart attack, but stroke, eye problems, kidney problems, and so on and so forth. Similarly, diabetes control is extremely important. Again, our patients, they need to understand the significance of checking their glucose levels, their hemoglobin A1C, and using the right entities as are right out there. And the physicians now have a lot of new entities for the control of diabetes. The dietary control in diabetes is also equally important, and exercise has an invaluable role in the control of the diabetes itself too. Lastly, about the cholesterol thing, we have already touched base on, but there are medications, and again, in the right setting, and we have different score algorithms too. Let's say if the patient is diabetic or non-diabetic, there are different risk calculators that can give us the idea how high is the risk in a particular individual with the given age, the race, the gender, blood pressure, whether or not they are on the medication for the blood pressure or diabetes, and what would be the right strategy. Is the lifestyle modification without a drug enough for them, or is it something that they need to control better with the different medications that we have on? So all these risk factors, they have their important role, as I said, and there are measures that can be used to optimize them.
Thank you. Yes, that was a very, very thorough explanation and breakdown. And I have 2 points that I want to speak on that you mentioned. And one is specifically when it comes to medications. As you mentioned, a lot of patients express frustration when they're on 3 medications or 4 medications. And I don't know if this has been updated, but the average American is on 3 to 4 blood pressure medications in order to achieve control. And sometimes explaining that to patients, number one, lets them know that they're in the majority. And so sometimes that helps to kind of help them with their fears about being on too many medications. But the other thing is, as you said, and this is what I say to my patients as well, it's not the number of medications that's going to make the difference to your health. It's the number on that blood pressure monitor when we measure your blood pressure. And so I go into some of these measures that you mentioned as far as lifestyle modifications to help bring that number of medications down, because it's the combination of all of the detailed things that you mentioned, as well as medications and the guidance of your physician, that's really going to make the biggest impact on your risk for having a heart attack. And then we'll go to break in just a second here, but I want you to just quickly tell us, with respect to exercise, does it matter if it's cardio versus resistance? Does the type of exercise matter in terms of reducing risk?
Not in particular. So there are different, pathways and different type of exercise available. Again, the biggest benefit, remember, is from a sedentary to the exercise. When we go in the details and when we go in the higher level of exercise, yes, of course, somebody doing more exercise probably is healthier and probably is at a lesser risk, we can say, theoretically. But in the larger data, those things don't contribute that much of a big risk modification. So important thing is regular exercise. It's not that how high, how big you do, but you need to do it consistently. That is where the whole advantage is.
Yes, with anything in life, consistency is key. All right, excellent. So with that, we're going to take our break here. You're watching What's Up, Doc on Muslim Network TV, and we'll be back after this short break.
There are 16 million children struggling with hunger in America. That's 1 in 5 daughters, sons, neighbors, and classmates who don't know where their next meal is coming from. Yet billions of pounds of good food go to waste every year. It's time we do something about it. Feeding America is a nationwide network of food banks that helps provide meals to millions of kids and families in need. Visit feedingamerica.org to help them feed even more. Together, we can solve hunger. Together, we're feeding America.
Right here, baby. Look. Uma.
¿Cuántos años tienes?
Something more than a birthday is happening here.
Once you can see it, you can help. The sooner you recognize the signs of autism, the sooner you can make a lifetime of difference for your child. Start by answering a few simple questions at screenforautism.org.
I am what hunger looks like in America.
I am an 8-year-old girl who's not excited for the last day of school. Because this may be the last time I'll have lunch. Till September.
I am a single father of 2 who works 3 part-time jobs, and that's still not enough to put food on the table. I was created by artificial intelligence from faces of the 1 in 8 Americans who struggle with hunger.
Feeding America, 200 food banks strong.
Assalamu alaikum. Welcome back to What's Up, Doc. I'm your host, Dr. Aalia Al-Barwani, and today we're talking about heart attacks. Joining us in that discussion is Dr. Usman Khan. So Dr. Khan, before the break, we were talking about different ways to reduce risk for heart attack. And you mentioned some really staggering numbers as far as 80% modifiable risk factors. And another one that you had mentioned, which was the low percentage of people in the general population actually doing things that will help their cardiovascular health. So it's wonderful that you were able to go through that with us. And hopefully those of our audience watching will be in that percent that are taking those measures, and that number will go up. So next I want to talk about what are the signs and symptoms of someone having a heart attack. We have different mnemonics. We had an episode on stroke and we did touch on that. So let's talk about heart attacks and ways that someone can identify in themselves or in someone else if you're witnessing something that may be a heart attack.
Absolutely. So I think everybody needs to know the basic and the prototype symptom is the central pressure-like chest pain. So that is kind of the key. Sometimes it can be radiating to the left arm. Yes, it's true, but not in all the cases. Any pain in the elderly, especially from the chin down the way to the mid of the abdomen, the belly, it could be from the heart attack too. That is not to frighten for every sort of chest pain, but in the right setting, of course, when the people have a sudden onset of pain with a lot of markers of high stress, including a lot of perspiration, sweating, heavy labored breathing, feeling as if they are having some a disastrous situation where sometimes people feel as if they're going to pass out, feeling that kind of a level of restlessness. That is considered to be one of the features in the heart attack where there is a high stress response of the body because the major organ of the body is under stress, and therefore the stress hormones are released and the autonomic nervous system, the sympathetic nervous system is overstimulated. Therefore, those symptoms are very important. These symptoms are so important that sometimes, especially in the diabetics or in the female, when there's no characteristic chest pain, people can have a heart attack without the chest pain too. 25% of them, they can have atypical symptoms. Then these acute onset of stress like symptoms, including the sweating, heavy labored breathing, restlessness, that could be an indirect symptom to start the workup for the heart attack too. So again, these symptoms has to be taken into account with the risk factors, which you just mentioned. The people with more risk factors with similar symptoms are more likely to have the heart attack as their original diagnosis, whereas the people with the lesser heart attack, with lesser risk for the heart attack and with atypical symptoms may need a little different kind of a workup. So again, as a layman, importantly, you need to recognize the symptoms, and whenever there is any question of, need to seek the immediate medical attention, and there are standard pathways to diagnose these entities.
Excellent. And if someone were to witness someone having a heart attack, you're with a friend and they start to either in the right age group, right risk factors, and they clutch their chest and they have chest pain, as the person who is with the other person having the heart attack, is there anything that I can do as the witness besides calling 911?
Yes. So, as a person helping anybody who they are witnessing with a similar nature, importantly is make sure that seek for the immediate help and attention at the workplaces or the people or where the people are large in number at the mass gatherings. They're always advisable to have the backup from the emergency medical services or the equipment in the form of the AED be available, because the biggest fear is that many of the people who have this heart attack, the heart attack may be itself life-threatening immediately, and people may collapse and they die. And that's not again to frighten, but that's a true fact which everybody is aware of. Not all the heart attacks give enough time for the EMS or the medical personnel to intervene on. Many of the heart attacks are so quick and rapid that there's immediately, if we don't have the AED help or the people don't know how to do the CPR, that might be difficult to deal with. So again, the people who have some immediate symptoms, immediate medical attention, calling 911, coming to the ER, getting the help is extremely important. If there's a situation of an emergency, like a patient has collapsed, checking the pulse and doing the immediate CPR and knowing how to do the CPR, the chest compressions and assisted breathing, that is very, very important, because the time is so crucial that if it started late and you're waiting for the EMS, things may not be favorable. Similarly, in terms of the medication, I would not give like a blanket say that everybody should take just aspirin and takes this and that. That is something that can be subsequently done. Yes, aspirin in most of the situations is not having a high risk of immediate complications. So yes, aspirin, majority of the time, the EMS will give, and it can be given by a standby person or if they have access to. But again, those things, despite their important role, can be done subsequently too. Most important thing is to seek the medical attention and save the time. The time is very crucial, and they say that the survival of the heart muscle depends on how quickly you would take them for the interventions and the right therapies.
Excellent. And you beat me to the punch there with the aspirin. That was going to be later that I was going to mention that with the aspirin, because a lot of people do seem to take it or think that that's number one thing to do rather than getting to the hospital as soon as possible. And as you mentioned, time is really of the essence when it comes to treating heart attacks, which brings us to the next point. How are heart attacks treated? As an interventional cardiologist and all of the other things that you do within the field of cardiology, I would be happy to be in your hands if I should, God forbid, have a heart attack. So what happens when a patient comes to the emergency room with a heart attack? How are they treated, and what do you do from?
So I think first and foremost is not all the presentation, despite having similar symptoms, are heart attacks. There are many mimickers. There could be stress, anxiety. There could be a lung problem, a chest wall problem, a GI stomach problem. There could be so many things that can just present as a heart attack. So as a professionals, once you are in the safe hands and you're in the ER and the EMS have arrived, the few things that are started, some are the supportive measures. If the patient needs the oxygen, initiation of aspirin, some nitroglycerin, which is like the medications to help relieve the chest discomfort. Those things are started right away. Importantly, in the subsequent workup, the EKG comes. The EKG has a very pivotal role in those patients because that segregates some of the very high-risk heart attacks, which need immediate intervention in terms of trying to open up the blocked vessels with certain devices we call PCI or coronary interventions, or if the center is not capable of performing those immediate heart procedures, there are certain medications called clot busters that can be given again in a time-sensitive manner. So again, time sensitivity is extremely important in all kinds of heart attack. And then if the EKG does not show, let's say, in the patients, the high-risk findings that indicate that they have a blocked artery, still the heart attack could be real and could be from an artery which was blocked for a certain time or unblocked, or was partially blocked without complete occlusion. So again, that second type of heart attack, where the artery seems to be not fully blocked and not ongoing injury happening and the heart attack has just happened, in those patients, typically they receive the blood thinners, and they are then subsequently taken to the cath lab, where we assess their vessels and we see if there are any blockages that need to be intervened. And typically, the patients who have blockages, either they receive the stents to open up the vessels, or sometimes they need the bypass surgery, depending on the complexity of the disease.
Excellent. I mean, it all sounds very complex, so that's pretty amazing. So before we wrap up, as unfortunately we've run out of time, time seemed to fly this episode, but I want to talk about aspirin one more time. And with this question, what I'm wondering is, for patients who are not having a heart attack or may not already have had one, because of course, if you have already had one, or if you have an equivalent risk such as diabetes, you're recommended to be on it. But for the general population who believe that taking an aspirin might be beneficial to help prevent heart disease, I know that was an older recommendation, but I would love for you to speak on that, because it's a commonly asked question as well.
So I think there's evolution of learning in all the areas of medicine, and in this area as well. So there were conflicting reports in the previous days. Of course, when I was in the med school, we used to learn about all the benefits of the aspirin and how beneficial it can be. And yes, it is beneficial, but at the same time, many of those things, with the passage of time, with the larger data that have come, have shown to be little exaggerated in the past. So again, aspirin has a role, but in the right setting. It's not something that can be just started indefinitely in everyone to say that is going to be just taking care of all the other modifiable risk factors and prevent the heart disease at large. It actually has its own side effects as well, and the people can have the other issues long-term without the benefit as well. So it has to be measured with the benefits and risks. It is, again, not strongly indicated in all the people or masses in general. The standard guideline at the moment, as we are dealing, and there's more and more data coming, of course, nowadays, and we have some indications outside the cardiology practice as well. But for the sake of the cardiology, we have to kind of find out the right patients who are at definite risk, or they have an established atherosclerosis of somewhere else, like in the neck vessels, leg vessels, where we have an established link that can lead on to the risk of heart attack and stroke in future. Those patients are definitely benefit most, and they are the one where we indicate it definitely. Apart from that, if the patients have different risk factors, the mitigation of the risk factors is more important than just taking the aspirin. So again, your physician has to decide as an individual decision making with your assessment what is going to be the right strategy.
Excellent, excellent. Thank you so much, Dr. Khan. This was a very enlightening conversation. I wish there are so many more questions that I would have loved to get into, but unfortunately we are constricted by the limits of the show timing. Thank you so much for your time. We appreciate you joining us, and we look forward to having you back here so we can continue this conversation. We wish you every success in your career.
Thank you very much, and I enjoyed working with all of you. And again, I hope this is helpful for the people who are listening, and we look forward to see you again. Thank you.
And thank you for joining us on another episode of What's Up, Doc. I'm your host, Dr. Aalia Al-Barwani, and I'll see you next time on another episode of What's Up, Doc.